Hi, my name is Shriya Garg. I'm a rising junior at the University of Georgia studying genetics and economics, and I'm very excited to talk more about our study focusing on palliative treatment and disaggregated Hispanic populations, specifically for cancer patients with breast, lung, and prostate cancer.
My name's Chris D. I'm a fourth year resident in radiation oncology at Memorial Sloan Kettering Cancer Center in New York. And I'm privileged to lead a global disparities and uh, cancer disparities research group. ASCO is a phenomenal meeting. I've been there. I think this is going to be my third or fourth time going over the years. And was really hoping that Ms. Garg would be able to join us as well, but it's tough to balance the schedule. But ASCO is a great experience because it brings together so many minds from all over the world. And I think what's unique about it is really how interdisciplinary the voices are. You get people who are medical oncologists, radiation oncologists, surgeons, nursing colleagues, physicists, palliative care, patient advocates, pharma, everybody kind of coming together to find ways that we can improve care for patients. But I think another important piece is that over the past couple of years, there's been really kind of a resurgence in the focus on the social determinants of health. We approach these questions from both qualitative and quantitative kind of modes of inquiry. And having all these voices come together in one place at ASCO is just really a great place to learn, to ideate, to find collaborations, and ultimately to find ways that we can help patients better. I want to thank ASCO really for kind of doing a great job highlighting perspectives and voices that are offering, insight into disparities and access to cancer care, both in the US and globally. Kind of putting my other hat on, the global oncology group really does, a lot of work that gets highlighted at ASCO as well. And I think, the focus on asking and answering questions about access and equity is really something that is important, something that is very directly related to our patients, and something that can hopefully inform policy and can hopefully inform how people access care. And ASCO is in many ways at the center of a lot of this. And I think there's something to be said for having everybody in one place, having all that creative juice flowing, and also being in a place that challenges us. How can we do better research by our patients, and how can we take this research and turn it into actual actionable steps every day?
I think that Dr. D really hit it on the head here. I unfortunately won't be able to make it to ASCO, but I'm hoping that in the future I will be able to kind of experience having a lot of the different experts in cancer and all the different topics to meet and be able to have informed conversations with them, especially as an undergraduate student. I think it's really important that I'm learning from the experts themselves in these issues and just understanding how to ask good questions, how to kind of go about research and make sure that I'm doing the best thing that I can to learn from other people as well. So I'm very excited to have the opportunity to present work at ASCO and see where it goes.